Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm still on this deal of child orthodontics or pediatric orthodontics, or just anybody working on children ought to know a lot of things about this, and they ought to be taught it in dental schools, and definitely taught to pediatric dentists or those that are going to specialize in pediatric dentists. And don't pay any attention to what people tell you shouldn't do this or that or the other. This is ridiculous. I started out with and I'm a general dentist, but I saw this problem right here, and I was in a town where I had lots of kids, and I figured out how to do many of these things. And you can do it too. And I'm just thank God for YouTube and Facebook and the other ways that I'm sitting right here in the little town of Glenrose, and this goes all over the world. And we're teaching people what can be done with children's teeth. And you can prevent a lot of orthodontic problems coming up. So I'm going to start off. These are kind of moderately crowded teeth, and you can get them to come in the mouth by sharing this space with deciduous teeth. And we do pulpotomies on the deciduous teeth. And I've done over 1,000 of these. I've never had one of them go bad. So let's get working on this. I'm going to try to show this child right here. Now I've got a video of this whole thing, so I'm going to go through this one fast so you can look at it. You can go get another view of it from another deal, the same little girl. Now this happens to many, many people in the States, and we're mixed up with every kind of nationality known. I mean, American people are about as stirred up as anybody in the world and mixed up. And so here's a little child that comes in, and they don't have room for their 3 permanent teeth. There's another permanent tooth down in a hole right here, and you can see the tip of it right there. Now, what you can do, you can infiltrate around this tooth right here. Do not extract these teeth. If you extract them, the permanent cuspid underneath will grow in where the root is, and all of these teeth will drift forward. And that is the wrong thing to do, and that's what's being taught in the dental schools now. So they just take them out. Don't do these pulpotomies. You ought to learn how to do the pulpotomy. And I've done thousands of these pulpotomies, and I've never had one of them blow up. You cannot put a rubber dam on them, and you drill in there use a sterile drill as a new one on every case if I can. Now we're going to take this tooth down, but I'm going to cut off down in here where the root is, and I will leave the root. The permanent tooth is coming in and bumping into this root. It'll keep it from coming too far forward. It'll come on up in here. Now, if you do this on one side, you got to come over here and do this similar thing on the other side, though it doesn't need it. But this tooth this tongue right here will shove these teeth around like nobody's business. And it'll push them out here, and the lips are going to grab the teeth on this side. That's nature's way of putting the teeth in there. And these teeth do not come into the mouth exactly right on anybody. They come in where they can get through. And then the tongue, if you're swallowing correctly, breathing through the nose, and doing things correctly, the tongue thrust, and don't be sucking thumbs and fingers and all this other stuff. And your natural forces here put these teeth in the place they should be. I don't give a darn what cephalometric method you're using. The best cephalometric thing is what is used in that particular person's mouth. And they swallow, and they bite together, they push their tongue out there, and this tongue will shove teeth all over the place if you don't think so. If you're a total mouth breather, you're breathing over the top of the tongue, you got it down here, these teeth will move out in this way, and the upper teeth will come inside of them. And the upper teeth are supposed to be fitting in here and going out this way. Now, this is a dadgum fact, and I don't care. It's going to be the true 100 years from now, the same thing. So let's get into this. Oh, they shut me up here. All right, now I'm going to take back when I started this, I used a long tapered diamond to go in and trim these teeth up. All right, we infiltrate. You don't have to block the thing. You just put in a little bit of anesthetic in here, and then you can come back and put more, deaden the nerve in this tooth, and deaden it over here, because you're going to come right over and do that other tooth. All right. Can you see this permanent tooth down in that hole? That tooth has eaten away. It's been pushed over to the side. It's caught under the crown of the baby tooth, and as the term gets up here, it can eat the root of the tooth away, but it cannot get through the enamel. And the enamel will hold this tooth in place until the other side of it is completely eaten out by the teeth coming in back here, and by that time, everything has shifted in that direction. Now, I figured this out years ago, a long time ago, that was what was taking place. So an old pediatrician from Shreveport, Louisiana came and spoke at the Fort Worth Society, and I learned to do pulpotomies from him. He didn't use any rubber dams or anything, and you pack it with pure zinc oxide and eugenol, and you don't need anything else in it, and you mix it so thick it's like amalgam. You pat it out, you roll it. I'll show you this later on here. All right, so I'm going to cut this tooth, and then we'll take it down over here so we deaden both of those teeth. All right, just setting up like this. We're going to take it over here. You can't use a disc now because you'll go down and cut the permanent tooth off. Now there's the drill that we use. Right now we use the last, what I was using, a long carbide burr, and just get a brand new one and get it sterile as you can get it, because this is what you're going to use to go cut the tooth, and then you go right into the nerve canal and go through the thing and just obliterate the nerve. Now these are all healthy deciduous teeth. This doesn't work if you've got an abscessed baby tooth. This doesn't work at all. Now I cut this burr, and I've cut this tooth down here. I took a little tissue off. You don't need to do that. Now this burr's going down through the tissue, but before I got to this tooth back here, I stopped it here. And you look at it, you can aspirate whatever you want to, and I'm in the nerve of the baby tooth. Now you reach in here with a kind of a square spoon or something and twist it, and you pop this section off of the tooth. And you can do this as good as anybody going, and you can do these pulpotomies. And I have done, you do 8 of these on each case, like this. And I've been doing this for years, and I've taught it. And there's very darn few people doing this anywhere where I've taught. So I hope that this spreads all over the world. This can be done for moderately crowded teeth, and if the person is functioning correctly, the teeth will almost come in on their own straight. but they'll be a lot better if they aren't completely straight, and you have to come back and finish them off. Now let's watch this thing as it goes. So here I've cut down through the pulp of the tooth, but I stopped before I got to this permanent tooth right back here. This whole lateral, in other words, it's a lateral a little bigger than the centrals, and it's over behind here, and it ran into the enamel here. Now I'm going to stick something in there and prise this apart, and I'll pop that thing off of there. Now we popped it off, and I can see this other tooth down inside here. So I take this long diamond and go around that tooth and cut this out. Now the root of the tooth is down in here, and I'm doing down through the canal on this root down here, just eating this up. Now the deciduous teeth, or permanent teeth, when they come in, the top part of these teeth is flat, but as you come down my head, they narrow down. They don't that fast. They narrow down, and so this down underneath here is not as wide. So I go in here and ream this out, and I get up here and clear it out. And a lot of times I trim this to keep from having a sharp edge on that to bother the teeth. Now I've got to go and do this, and then I've got to come on the other side and do a similar thing. All right, we take a little pile of zinc oxide, and you put a drop or two of eugenol in here, and you mix that up, and you get that so stiff. I would take this, peel it up, and I put it on paper and push against it real hard and squeeze all the eugenol you can out of it. Take a spoon, something like this, cut it off. And then I take this piece that I cut off over here, and I kind of stick to this spoon. And now I take that, and I'm going to shove it down this tooth. This tooth was up like this, and we cut it in two, and I drill down through the nerve canal. Don't worry about the blood. That's what you wanted. It'll bleed up here. If you got a bacteria down in there, don't worry about it. You're going to pack this down in this hole right here. So you take that point of this, and that stuff is thick it's like amalgam. Shove it down in this hole. This can be full of blood, and you push it in there, and then you smooth it off. Then you get some more and come on top and take a amalgam plugger and mash it down in there. And I don't care if it goes completely through the tooth and sticks out the end. It doesn't matter. It's not like doing a root canal. Sometimes I think if you took a root canal and cleaned it up real good, you might could push zinc oxide eugenol out the end of it. That doesn't bother the body at all. It just stays there. But I haven't tried that yet. So anyway, watch what happens. Now, here I'm going down in this tooth. I'm taking it down in here. Don't blow any air in this tooth to clean it out. Leave it alone, or if you want to put a suction on it, okay. But you don't need to suck it out or anything. Let the blood stay there. Now I'm going to shove that down in that tooth, and I'll get it down here and smooth it off and stick some more in. Take a amalgam plugger and push it under there under pressure, and then I trim this tooth up here. Now from now on you can work on this. It doesn't have any feeling in it at all. Now this tooth right here that's coming in moves over here, and it'll line up. The tongue pushing from this side moves the tooth over, the lip over on here. If this end comes out here, it'll push it, and it helps it get in there straight. Now you go over and do the other side the same way. And don't think you be so holy that you've got to put a rubber dam in here, because you're going to grind the cotton picking rubber dam up, and you don't need it in there. I have never used them because I've learned you just wrap them up, and you go down in here, and I never had one of them go bad. Nobody got infected from it. I used a clean burr, and we packed the zinc oxide and used it all in there. Went down in it, reamed the nerve out, come out like that, packed that stuff down in there. Then I took an amalgam plugger and put pressure on just like you was packing it as far as you can. If it comes out the tip of the root down here, it doesn't do anything wrong. All right, we're going to smooth it off, trim those so they don't cut the lips, and you can aspirate the blood out or whatever it is to take a picture of it, and we'll turn it loose. Now this, I don't have the date on this, but here we are a few weeks later. This tooth has come over, moved up and taken up this space right here. This one has taken some, and there's a pressure. The tongue is pushing from the back side, and these teeth just kind of migrate over, and the root of the baby tooth is still there, blocking off the erupting cuspid from coming over into this space. And it is wrong to extract these baby teeth because that's a simple thing you can do, and that's what people are doing, and that is a ridiculous thing because now they're going to lose arch length. The cuspid's going to come further up in here, leave this root alone, and this tooth will eat it up, and then it'll come on up in here, and you'll lose this part left here when this goes, and you take the deciduous tooth behind it as the second phase. All right, we've pulled it up to that far, and the tongue is working on it, the lip is working on it, and look how much, and I haven't touched it orthodontically. You let nature do what nature planned to do, and we come in and interfere with it. All right, this tooth has come in, it's almost pushed over to that side, and that tooth is taken up over here, but you gotta do the same thing over there you did over here, even though you didn't need it over there, and now the teeth are moving in that direction. Now, you come up above, you got the same blooming thing is wrong. You got big old lateral teeth trying to get it come in here, and they don't have room, so there goes on the outside of here. You can see it, and you can look on your panorex and see it. So we've got to do something here to get these teeth to stay in this pressure zone. So we take these two deciduous teeth, take them down. Watch when you get close to that tooth, stay away from it. Come back in here and pop it off. Cut this down here, and you'll watch that straighten out. Now you look back in here, look what's happened. This tooth has moved into this cut place over here. I didn't touch it, and I can't get that across. Everybody working on kids ought to know how to do this, and they ought to be taught it in the dental schools. Pediatric dentists definitely ought to do this and know about it. It works. And if somebody's swallowing wrong and breathing through the mouth, it doesn't work as well, but it'll be better. Now this is almost moved over. Now this tooth was way over in this part, and we took this down. This is moving in this direction. This big old tongue is pushing on it. Every time you swallow, it shoves in there, shoves this out, and the lip is catching it here. And the teeth come in this part right here. And this zone where the pressure is the same, and that's where the teeth need to go. If you put them there, then they tend to stay there. If you expand them out past and you're pushing against the lip pressure more than you've got tongue pressure, you'll have a relapse on it, or you're going to wear a retainer for years until it gets it pushes the teeth out to where they go to a neutral zone, and then they'll stay there. All right, we trim this up here, these teeth stay. Now this is the first phase of this is over. Now you're going to lose one of these. This goes, you take this out. Take it out. Now, you're going to do back here and the second bite, you're going to cut the second deciduous molar. You cut the mesial off. You look at this in the Panorex and it'll show you just about what you've got to do back here. So this is, look at this tooth. It's moved inside of this cuspid tooth. And this one is over, very good. But our midline is still off. It still will move in this direction. All right, that's the upper. I'm sorry, it's bloody. It scares some people off. It doesn't bother. Now you going down here and you find this tooth, then you cut around behind the tooth. And you got a little space in here about the size of that burr that you haven't touched this tooth. And then this, as it comes in, the tongue's going to push on that. Now it's, see, this is crowded, but this will move in this direction, and that frees this up. So this tooth will go in this direction. The lip's going to hit over here. It'll go in that direction. This is out here. The lip's going to press on it, and so this will slide over here, and you bring this tooth to come into that spot. Now, I figured this out on my own. I was a general dentist, and I wrote a paper up on it. And I had an orthodontist right there close to me who didn't, this one I shouldn't talk about him, but he's gone now. But he was bad-mouthing me. He didn't have a foggy idea of what I was doing, and he didn't know. So I put a table clinic on this and won the cable clinic. And next year I had to speak to the whole dental society, the Texas and the Louisiana together, on preventive and interceptive orthodontics. And I got so much publicity from that till I started doing dentistry and just did nothing but orthodontics. So I got into orthodontics through Pediatrics, and then went on through it, and then ended up in doing older people too. So let's watch this now. Go see it. Look at that. Sucks right in there. This tooth is almost over here. This one is. This was out like that. It's moved that far. The tongue's pushing in here, pushing on this hard, and there's a push on this some. If you could take that off, and this would come in a little better. If you want to trim that and get a little more, there's no feeling in this at all. You can take a burr and cut it anywhere you want to. Now these teeth are permanent teeth. Now that's come in and lined up like that. Now these teeth up above are just about straightened out up here, but that's going to be a while longer before that does that. Now this is taking this up. This is lining up now. This needs to go. I probably could have come in and taken a little bit more, let that come over, and let that straighten up. But it's going to straighten up when I'll lose that tooth. When I take this one out, one of them, either one of them goes out, you take the other one out. And so you empty this spot right here. Now, down on this side, it's still there, but we're going to take this out. And if I'm not wrong, the cuspid is erupting back in here somewhere. Now you watch the patient. Look at the midline now. Well, there it's lined up. But now this tooth we lost. The baby tooth now is completely eaten up by the tooth that came in. But this cuspid is up against a permanent tooth now, and so it's going to go in correct position. And this cuspid over here, when you lose that baby tooth, it'll go there. Now you can look at the top. It's almost straightened out. And I haven't touched it with any orthodontic thing. But I'll tell you, this is better orthodontics than anything you can come up with. And it'll be this way 100 years from now. It's not something that's going to vanish unless human beings start growing different. And they're not going to do that. And that has done this on its own. And this is what I try to get across to people. And this can do this all over the world on any nationality, anybody that's growing alive. And you can move teeth on people as long as they live. Don't let anybody tell you you're too old, your teeth won't move. This is a falsehood that has gotten started, and people just anywhere think about it. You can't do it. I have people writing in, they go to show us to an orthodontist, and they say, well, you can't do this, you're too old. This is a bunch of bull. They are not too old, and you can do this. Now watch this go from there. All right, the second phase of this is going to be the second deciduous molars, what you're working with. You extract this tooth, and now this cuspid that came in over here, watch this tooth. It'll shove it right into that hole. And now the first bicuspid is going to come in, and it's going to move back into part of this, and you're saving room here for the second bicuspid to come through. Now watch this. We took this tooth out. This cuspid's going to come up into place, and this bicuspid is going to come in, and we're going to take this root out down like that. This bicuspid will move up here and shift over into that, and the tooth will be setting up against that. It'll be a bicuspid here, and the cuspid will come in and fill that other gap. Now this is dealing with moderately crowded teeth. If they're too terribly crowded, you extract some teeth in there, and the teeth will come in like we've shown that serial extraction procedure. Now, I take that tooth out, and I go back to and I infiltrate around that tooth. I don't block the whole end of the jaw or anything like that. So we get onto that. Let me look over here. I'll lay that brush down in fat, and I cut down through here. And I'm going to run into the canal. Don't get up close to the canal and think you won't have to get into the nerve. That tooth will drive you nuts. When you get anywhere close to it, take the nerve out, you won't have any problem with them at all. And you pack that zinc oxide and use it on. All right, I've cut the side of this tooth off. I take a long burr, long-necked, round burr, about a number 4 round burr, and go in and go through the canal into the nerve, and then I go across and get it to the other side with that burr. So I go in there, and I ream it out bigger, and I go in both necks of the nerve and trim that down, where you can pack this zinc oxide and use it all in there. You cannot put a cotton picking rubber dam in here. You'll tear the thing up, and I've never had one of them blow up on my own. The only one I had, an old surgeon who was an MD, DDS, was trying to do this. He didn't know anything about it at all, and his failed. But when you get up here and you cut this off, this stuff is like amalgam. It's hard, it's stiff. It's eugenol, it's been the zinc oxide has been packed out, and squeeze as much of the juice out as you can. Take that, don't blow in air, just aspirate it, or you don't even need to aspirate it. You can just pack this right through that hole, and take that and you shove this thing up in there, and then you take an amalgam plugger and push it in, and then you put some more to clean, and that's all in the world you need to do to it. Don't crown it, don't do all sorts of messy things. I mean, was lecturing one time and had the heads of 3 pediatric departments as were there at the meeting. This was in Boston somewhere. And they were, oh, well, we're going to have to mix some creosote or some other thing with that or it won't work. This is not true. All you need is the zinc oxide eugenol. If you squeeze it down, goes out the root, it doesn't bother anything. There, it is, and that'll stay there. If tooth didn't come in, it'll stay there the rest of the life of that tooth. So this little girl, she looked at me when I got through with this second face, and you could see in her eyes, she said, "You sorry son of a gun," and everything. So, but she got over that, and she's going home. And now, look at these teeth right here. This is down here. Look at that tooth in place. I have not put one thing in there to make that happen. Nature did it. And nature can put the teeth where they ought to be. The pressure from the lips is out here, and the pressure from the tongue is inside. If that is screwed up and people are doing things they shouldn't do, it won't work like that, but it'll still, this will work and help the way. And this will come in and watch this bicuspid go into that space. And the midline is lined up there. Now we go in and we're going to do the upper part back here. Now this, if you've got a tongue-tied situation, you need to get in there and do that early anyway, or it'll put extra pressure and pull these teeth back here in the front part of the mouth, like that. Now look, this cuspid, you remember this cuspid was coming in lingual. The tongue, which is up when I took this picture, pushed that tooth in there. The lips held it over here. Look at this line right here. That's where the lip pressure and the tongue pressure come, and there's an equal zone, and that's where the teeth go in that place. I don't care who you are, where you are, what kind of nationality you are, and it'll be that way 100 years from now. It'll still do the same thing unless you change human beings. It's going to be like that. That's not something you're going to learn how to do, and it'll be wrong later on. This will be correct 100 years from now. Now you come in and trim this. We did the pulpotomy over here, the pulpotomy, and we left more than enough room for this, and this tooth is squeezed in there. Let's look at it from the top side. Look where this bicuspid went right up here, and then it dropped back into that, and the root of that is still there, that 6-year molar. And now your bicuspid is going to come up in here, and your 6-year molar will come up behind it, and it will be pushed into place. This has had nothing in here. So don't go home and figure you got to put a lingual art and all this mess in there. Leave it alone. If you do anything, train them to swallow correctly. Train them to breathe through the nose, or spread their palate out and help them get their airway open. That's the best thing you possibly do for that person. And now this line right here is the correct position for these teeth. I don't care whose cephalometric deal you are working with. It isn't worth a dime. This is the one that counts. And that's what's happened in here. Now let's watch it. Now this we have one problem. Maybe this cuspid's coming in way high up here, and you may have a problem getting it back into position. So some of these need a little touching up after you get through with it, but some of them will work out almost ideal. Now look at this way it happened in here. Now, I have not done anything in here. Look how much of this took place. If this is too big for your bicuspid, the 6-year molar will come forward right in there and fill that up. And this is the best orthodontics that is possible to do for people. and it has not taken hold. So many people want to put Invisalign. I have nothing wrong with Invisalign. It brought a lot of people, adults, in to get their teeth done. And I know how to straighten their teeth. And I never did an Invisalign case that I didn't have to come back and do something with a few brackets and a few wires in there to finish the case out. But it'll straighten up your front teeth up here if that's all you're interested in. You'll line them up. They're flat teeth and they'll rotate. Rotating a round tooth is a different ball game. We have a method of rotating any tooth anywhere. You can turn it 365 degrees if you wanted to. And you can certainly rotate it. I mean, very simple. I have a video on rotating teeth. And I'll guarantee you, you can rotate anything, walking and breathing, coming into your office. I don't care how old they are. If it's ankylosed, you break it loose and you rotate it. Now here's the little girl, came in and she's, after we did, she doesn't have to have braces really, and she's kind of happy. If I'm not mistaken, she grew up, she moved to another town, she got married, she had a little girl, and she brought this little girl to me to do the same thing to her that I had done to her. Now I'm going to hush. But this works. And if it doesn't work, somebody that's got some sense can tell me I'm wrong. If you can prove it, then I'll quit doing it. But this is a way to help nature put a semi-crowded case in where the teeth work good. So I'm going to hush, and if this is not right, somebody with some sense that does it can tell me it's wrong. But don't come in here and tell me it's wrong, and don't tell me what is right, because I'll check it out to the very end. And so I'm going to hush and say goodbye, and I hope you'll join our course. And we got nearly 6,000 people that have signed in with us, with our videos and stuff, listening to them. And I've got over 870 videos. You can go back and study them back from where they started if you want to. And I'm trying to come back and put pressure on those people. Excuse me. It just burns me up that the departments of orthodontics in the universities will not let the pediatric department do any orthodontics. This is wrong, and I can't stir people up enough. I tell you, every pediatric dentist or anybody doing ortho on kids and young people ought to get together and demand that the schools do this. I think we could go to the governor or whoever is funding the schools and show them what can be done, and it ought to be done. And so I want to get pediatric dentists, if you're out there and somebody tells you you can't do this, I know what to tell them, but I'm not going to say it on the air here. You can do it, and you can do this, what I've just done on this girl. So I'm going to say goodbye, and I'm going to close out. And there she was when we started. And it takes a few years to do this, but you're seeing that girl, and you have an influence on this young lady as she grows up, and she's going to be a lady. And that's something orthodontics have this challenge. If you work with this person all the time as they grow up, you can help them in a lot of different ways. So I'll say goodbye.